And we'll move into our COVID weekly update with Kathy and Jamie are here today.
Good morning, Mr. Chair and Commissioners. I think you've all received the handout with the data as of November 23rd. So in Clay County, we have 4,451 cases that are positive. We are sitting at the 55 deaths, and our 14-day case rate per 10,000 people is 161.30, so that went up from the previous 14-day period, which was 123.4. So we know that case rate is going up as we're testing more people and we're seeing more positive cases. And again, that's the case rate that the schools use, one of their data points to determine their learning model. The Minnesota positive cases, 267,500, and we have 3,265 deaths. Their positivity rate cumulatively is 7%. So you see the numbers still continue to increase as far as our cases. The next page gives the grid. So we have 883 active cases as of November 18th. So that's how many cases that we're currently following. The exposure, and that has increased as well, the number of confirmed cases, and of course those no longer needing isolation, and then the active cases. And the exposures are still pretty consistent where it's community exposure as well as sometimes it's unknown. And then the ages of cumulative cases. So Commissioner Campbell had asked for the ages of active Clay County cases. So you can see we have the grid on top where it's the cumulative cases, and then the grid on the bottom is the ages of the active cases. So you can see, a little bit of variation with the ages, but we still have the 20 to 24 and the 30 to 34 that, as far as our active cases, are the top, and then the 25 to 29. So those groupings are the cumulative cases, of course, for the 20 to 24 that you can see are the highest. So some similar age categories. Is that what you were looking for, Commissioner Campbell?
Yeah, that helps.
Okay.
To me, it tells a story.
Yeah, it tells the story. That's right. So, so any questions on, as we're looking at the cases that continue to rise in our counties, and as well as in Cass County, we're also seeing the increases. I believe that data. Oh, did I forget to print that off? Oh, I apologize for that. I don't see the Cass County data.
Kathy, I see, thanks for including the ages of Clay County cases. I appreciate that. Do you have the average age? Unfortunately, I heard yesterday we had another death, which is sad. And so we're at, 56 deaths. Do you have the average age of those that we have lost to COVID?
44 of the deaths have been in long-term care facilities. So the age categories there are the senior population. So the other, I don't have completely the ages. We had a 21-year-old. Oh, thank you. Thank you very much.
Thanks for that.
We had a 21-year-old, but I don't have the numbers of the other cases. I can certainly get that. So 44 of those were long-term care.
And I think that I'll talk a little bit about that long-term care piece, but I think it's important to know that we're seeing this spike within this certain age demographic of cases, and even though it may not affect you, you may feel fatigued or maybe get over it right away. You are likely spreading it to folks in these other categories.
Correct.
That will experience far worse conditions. And I think that's that's the message that I think is getting lost with people is, oh, I got COVID and I felt fine the next day. Well, did you infect anybody else? And if you did they feel fine right away? I mean, that's
Yeah.
the question that I think people need to think about.
Sure. And Jamie will touch on that as she talks a little bit about the app.
I want to expand on it a little bit more, and it even, I mean, that's a real critical piece of this. But also, and I said I think there's, among some age groups, I think there's a lot of carelessness. And that carelessness is also causing our businesses to have to be shut down. So it's even economically hurting. Not only that they can spread it to somebody who might have conditions, but the age groups that are more susceptible to this. So
Right.
so it's a double-edged deal here, and until people wake up,
Yeah.
we're going to be shut down for a while.
Well, and we talked last week about, even managing your Thanksgiving gatherings. Now, again, it's because you have, various age groups getting together, and it's the asymptomatic spreaders, can be the youth, can be others. So, the CDC was initially saying no more than 3 households together. They made that a little bit stronger because there's so many gatherings where people are spreading it, and unknowingly so. And so now they're stating, they really are recommending just your immediate household and not gathering with other households. I know it's a tough pill to swallow. People we know, are not going to follow that. But that's because the numbers are so high and they continue to rise, and we expect them to continue to rise in the next couple months, particularly because of the holiday gatherings. And so it's hard. It's economically hard, and it's hard for those that are spreading it to the most vulnerable, the ones that have diminished immune systems, and those that are more vulnerable to hospitalization and death. So that's why the message is so strong about those gatherings. So we send the message because that's a recommendation by the experts, and what they're predicting for the future of this virus. So the message is clear: to avoid the gatherings. It's another way we can try to stop this virus spread before we get the vaccine. What Colleen handed me was the Cass County case numbers. So they have 15,405 cases. So that's up about around 4,000 from the last week. And their cumulative positivity rate is 20.38. It was 16.99 last week. So theirs continues to rise as well. So we have some increases on both sides of the river. We just have to understand that to slow the spread, we still state the obvious measures until there will be a vaccine, which will be some time yet before we get a vaccine for the mass population, and then be able to have herd immunity. Once we get 60 to 70% of the population vaccinated, then we can have that herd immunity, so keeping everyone safer than we are. Questions on, before Jamie jumps in, any questions on any of the data?
Okay, I have a hard time seeing when I look down with my mask, so I'll have to hold this up. So first of all, I just want to talk a little bit about the saliva testing site in Moorhead. We've been sharing those numbers with you. So the week of November 15th, there were 5,817 people served. Number of Minnesota residents was 3,201, and the non-Minnesota residents were 2,616. Of those, there were 453 that tested positive, and our positivity rate was at 17.11 that week. The previous week we had been at 21.09, and the week before that we were at 22.18%. So that's kind of where we're sitting with our positivity rate. Again, the response has been excellent. from those that are participating. We did share your comments about, not really knowing what to do once they are there. That's part of what we're working on with our media campaign as well. That same comment came across the state from other public health agencies that are hosting the saliva testing sites. So Minnesota Department of Health also is sharing that information with Vault, the company serving them, that it's not real clear, what do I do,
Thank you.
as I wait for my test results. So that was a common theme that you shared across the state.
And let me just jump in real quick. The hope was that there would be a handout for people.
Yes, I
And-
think that would be very
And
good.
Volt had, their ideal process was, paperless, but we're hoping that they'll accept just a handout with that information in there. So that's what we're working on.
We talked a little bit about posting signs, but there's just so much, it's kind of, if you walk in and there's so many things posted, it's a little overwhelming, and it's, that sign everywhere song, you just don't see it, basically. It's too much information if we post that. So we're working on that at the state level with Vault. The next thing I want to talk about is just a little bit about the vaccine. The vaccine hesitancy is still out there. There's a lot of discussion about whether people will have vaccine or not. And just wanted to really stress the fact that the reason, the concerns are about the shorter time frame for developing the vaccine. And the reason for that is resources and manpower. And so if we think about it, it makes sense as we add more resources, financial resources, and we add more staffing, we are moving quicker. But the COVID vaccines, basically the trials have included tens of thousands of study participants to generate the scientific data and other information needed by the FDA. So basically, the FDA is still making that determination about the safety and the effectiveness of the vaccine. The clinical trials are being conducted according to the rigorous standards of the FDA. That hasn't changed. What has changed is the resources and the manpower being contributed to that process. And in the first phase, there's generally a small number of healthy people that are tested. In the second phase, there are more people with various dosages tested on hundreds of people with typically varying health statuses and different demographic backgrounds. And then thirdly, thousands of people in randomized controlled studies involving broad demographic backgrounds. That process has not changed for this vaccine. Okay, next thing I'm going to talk about is the COVID Aware Minnesota app. My understanding is this app is being used by many states. The commissioner in Minnesota, governor in Minnesota actually talked about this, and the commissioner of health and the director of the infectious disease for Minnesota Department of Health in a public announcement. But basically, the more people that use this app, the better it works. So they're encouraging us to download the app and get it. The Apple and Google partnership was created with data privacy at its foundation. So that, concern of data privacy, Apple and Google are working on that. It does not use GPS or tracking your location. It does not share your identifying information with others, not Google, not Apple, not the Minnesota Department of Health. It does not access personal information on your phone. When two phones are within 6 feet for 15 minutes, they exchange codes via Bluetooth. When someone tests positive, they receive the code. The positive person can then type in the code and alert others anonymously. The exposed person gets a notification that they may have been exposed during a general time frame. No location is given. This can be helpful for businesses, religious spaces, schools, universities. Anyone who spends time in Minnesota is encouraged to download the app.
Jamie, I had a question on that. Would that pick up, in the case of our local area, would that pick up North Dakota phones?
It should, basically.
So if they download the app?
It's about the location. So basically, it is a code that you get, and that code notifies others that have been around you. And the other thing, too, is that it really is, they're encouraging like universities. The only thing that they kind of talked about, the infectious disease director talked about, like our plastic dividers may create a barrier. But again, if you think about that, that's a barrier to protect you as well,
Right.
Were you going to say something?
No.
Okay. Then the next thing that I wanted to just, I understood that we were going to talk a little bit about convalescent plasma, so maybe I will just pass that on to you.
Yeah, well, thank you. So, so we've been talking about this plasma, and I have somebody close to me who works at Sanford who's did some research on this, and I think there is a difference in there have been people who have been asking, well, if I donate plasma, can I designate that to go to an individual? No, you can't do that. But what you can do, depending on where you go, for example, Vitalant, and I was told Red Cross, but Red Cross we might have to do a little more research on. But those two, any plasma that's donated goes to patients. The BioLife and Telecris, those go to research. Now, obviously, that's important too, but I think they're, and so, for example, Vitalant and Red Cross, they do not pay for the plasma, but that plasma then goes directly for patient care. The BioLife and the Telecris, they do pay for it, and I suppose that's partly why it goes to research, because I'm sure that's where the money is coming from to pay for it. However, there was this individual mentioned that a person could go to do the, like the BioLife, I think you'd get $400 for donating twice, and now I think it's gone up to $700 for 8 times or something like that. But there's also the opportunity where you could do that and then switch after a period of time to the other one where it can go to the patient, or you could do the patient one first. But you have to talk with them. But I think there's been a lot of interest in the public on wanting to get their plasma to the patients who need it, because that's in such a limited supply. And so that's the information that, and I think you kind of confirmed the same thing.
Right, I communicated with a couple of the medical officers at both Sanford and Essentia who confirmed about Vitalant. They didn't mention Red Cross, but Jamie noted that they have a way to sign up for the convalescent plasma is what they call it. I just wondered if Red Cross, I know that they provide probably the donations around the nation. I just wanted to make sure that they did provide it to our immediate hospital systems, Sanford and Essentia. So they certainly are taking those donations of convalescent plasma, so that is correct.
Yeah, I guess it's having had a lot of people asking about
Yes.
being able to, wanting it to go to patient care. The answer is, if you want that done, Vitalant is the one, or Red
Right.
Cross is the place to go for that.
Right.
And you won't, but you will not get paid for it, but at least it'll help the patient care, so.
Yeah, so thanks for checking into all that. We'll definitely put that out on the website and in various places, so people are aware of that, so appreciate that.
Thank you.
So can I share a little bit of information about that? I know we've talked quite a bit about this at the board meeting, but I think looking at the number of people that we have in the community now that have recovered, we want to make sure that people do understand. It's like, if you fully recovered within the last 14 days, you can donate. And so what that means is that basically, because you were able to fight off COVID, your body has antibodies that are in the plasma that if you donate that, it can be used for people that are in the hospital. And so just to be clear on what that means, convalescent, somebody's recovering, and so you're able to donate that. So if you've been positive and you've actually been more than 14 days since you've recovered, you have the ability to help someone who isn't able to fight off the disease themselves. And so that is, I did call Vitalent directly, and they said that all of their donations go locally. I wasn't able to connect with Red Cross, but their website says to help patients, you know, and that's as far as we could get to confirm that, but we will follow up on that as well.
So based on your numbers, Jamie, there's 3,500 people that we know would qualify right now to do that.
Right, exactly.
Absolutely.
Yep. And it's very easy. I went to both websites, you know, all I did was type in donate plasma, convalescent plasma, the Red Cross, and Vitalent. It's easy to register online. For Vitalent, they were booked out till December 11th was the first available appointment on their website, so that's a good thing. I think people are getting the message and registering. With Red Cross, it says that they will contact you in 2 to 3 days to schedule an appointment. The thing they have to do is make sure that you're able to donate. It's based on your weight, it's based on medication. So if you can donate blood, you can donate plasma. Then the other thing is it has to be at least 14 days since you've recovered. So Vitalent is in Fargo.
Jamie, do they test if you go in and don't have a positive case on file? Do they test your plasma for antibodies?
It does say that in order to schedule an appointment, you need confirmation.
Okay.
that
But
you
they'd
have
still
had.
take plasma donations anyhow?
Yes.
Correct.
Correct?
Yes.
So if I were to donate, would they test my plasma for antibodies?
That's a good question. But on their website, it says if you want to donate convalescent plasma,
Okay.
you need to have that positive
Okay.
test confirmation.
So, and again, I've seen a situation where there was somebody in the ICU who could not get the amount of plasma that may have helped because there wasn't enough.
Exactly.
So, that's kind of the message.
Yes,
If you have a loved one that's out there
yes.
and you want them to get what they
They need.
need, so.
Right.
Absolutely.
And again, there's phone numbers too, you know, we can post those on our website and on Facebook. Just because you can't get an appointment until the 11th doesn't mean, it's kind of like our saliva testing site. The appointments are booked up, but they say just walk in. So I want to encourage people to call, and we'll post that information. The addresses and the phone numbers for Vitalent and Red Cross, or American Red Cross.
Oh, yeah. And just back to Commissioner Campbell, you were asking when Jamie was talking about that COVID aware Minnesota, and there's 20 plus states that are using that. North Dakota isn't one of the states,
Okay.
and so they will have the ability.
Well, I would think because we're up right on the border area there, it should,
Right.
if you're,
It should, yeah. And now that they're one of those states anyway. it
you have somebody with a
doesn't-
Fargo phone over here.
Right,
Right.
absolutely. So, yeah.
Yes, your chair. I have had some discussion with medical staff at our area hospitals, as well as long-term care facility administration over the last week. And the message that was underlying in all of those conversations was that they are being regulated so strongly by the Department of Health and Public Health and following all of the parameters to which they've been given, but it's not enough to keep their staff safe. And so in those conversations, the question just came, why isn't this message getting portrayed to different areas to help us keep our staff safe? And I understand that the governor's order has kind of changed a little bit about that. But can we talk for a second about the 14-day case rate per 10,000 people? And when the governor came out with that recommendation in August, the recommendation was, here are the parameters up to 50. And there are areas, school districts within our county that are following that pretty well in terms of what they're doing with schools. I know some of the schools are going all online, but then some our case rate is 160 right now.
Right.
There are still schools that are meeting in person based on that. And so I've asked countless times in different weeks. We did all of this in April and our case rate was this. Now our case rate is this. What are we doing? And so the question from the administrators from these health facilities was, okay, what's the recommendation now that we're off the charts based on where we were? And we're on borrowed time with keeping staff healthy if these numbers are just expanding to what they are. And I don't have this stat in front of me, but if you just do simple math and think, okay, if one person that's positive infects 1.5 people or 2 people, which I think is probably on the conservative end, then your positive cases just are growing exponentially. And I think we've kind of seen that based on what the graph is doing. So what more can we do, or what more are you hearing from DHS about these case positivity rates that are off the charts?
Yeah, and then Jamie can jump in too. The positivity rates are high. This is quite a surge actually across our country. The reason why they're using that rate for K-12 and higher ed is it's just one tool in the toolbox. They have multiple tools that they have to look at. So how can they keep the distance learning or the hybrid or in-person? They have to base it on their staffing. Now that's, again, I'm going to the K-12 and higher ed. So they're using this positivity rate just as one tool. But what they're finding in the schools, the spread is not in the schools. It's a safer place to be for the K-12 students. It also seems to be a safer place in classroom for higher ed. The spread is outside in the community. So what they're seeing is it's this community gathering, the community groups, being out and kind of throwing caution to the wind and not following the guidance. So it's not that the schools, if the spread, and we give the schools all their individual data, if their spread was really high in the schools, they would change course immediately, but it's not. It's the numbers are low. And for working all distance learning, it's a hardship on those teachers. They're really struggling with that, so that gets to be a challenge. Now in long-term care, it's a different story, and I know that each long-term care facility, and Jamie has worked more closely with those, they have a resource person assigned to them. So each long-term care facility has, and it's MDH, a person that's assigned to assist them with all of their need to test, with all of their infectious processes in place. DHS is who is making the stringent rules. So the Department of Human Services, who licenses the long-term care, they're really, the rules are pretty stringent. MDH is providing the resources for each of those facilities, and Jamie can expand on that
Well,
a bit.
and I get that, but what they're saying is they're being monitored, rightly so, because of why I asked what our death ages were. 44 of our Clay County deaths have been in long-term care.
Mm-hmm.
So rightfully so, they're being scrutinized more. But what they're saying is we are just a moment away from an exposure in a nurse that they get through community spread, which again, on this graph, it's coming from community spread, to it getting into their facility. So they're following all the rules they can, but
And we agree with that. You know, the issue is that it is about community spread. So, you know, that's what we're trying to control. You know, talking about one household for Thanksgiving, talking about, you know, not traveling outside of the state of Minnesota, you know, those kinds of things, shutting down businesses. That's about trying to control the community spread.
Right.
Also the app will help us to get information to people quickly. So you know, that's the case. It's about community spread, which is a challenge, you know, when it's coming into their facilities.
And just for the sake of argument's sake, I understand that. We've canceled our family plans to leave because it's not the smart thing to do right now. But if my kids can't sit at a table at Thanksgiving with members from one other family or 2 other families, then how are kids in Clay County still sitting in a classroom with 20 other kids from different households? And I it's crazy trying to teach these kids online. I'm living it. A lot of people are. But that's where I think people are starting to get frustrated, is how do you rationalize me not sitting down at Thanksgiving with family members when we have, kids in classrooms or parties like Kevin's talking about, the people that aren't taking it seriously. It's just, if we're gonna be all in to try to protect our vulnerable people and keep the hospitals open, then we need to be all in. But it's just, there's not the same story or regulation that's happening to those facilities based on other areas.
Mr. Chair, thank you
Yeah.
for those comments. I want to point to this again.
Yep.
Based on these numbers, if you were in the age group from 15 to 44, you have 77% of the active cases in Clay County. Ages 15 to 44. And if you look at these charts, the current active is pretty close to the cumulative over the time.
Yep.
So, again, out of the 4,436 total confirmed cases,
Yep.
probably 75 to 80% are from that same age group. And again, I'm trying to pinpoint here where I think there's a problem. And the problem is, I think a lot of these people in this age group, they go through this and they see it, and their friends have had COVID, and, oh, hell, that was no big deal. I got through that like nothing. 99% of the people who died, I'm sure 99 point something, are outside of that age group.
Right.
But they got it from somebody.
Right.
So if you're in the 77% that have it, chances are you're in 77% of the ones who are giving it to others. It would just seem to me that mathematically that there's a stronger chance that that's where the spread is coming from. So I guess my message is there's got to be, amongst these age groups, there has to be a little bit more realization as to what's going on here and what they can do. I've had COVID, and since then I just want to share an experience. I went into a place, and I'm not going to say where, and I went in there, I walked in and I had my mask and I sat down and I watched these kids come in, no masks, no masks. And I flat out said to one of them, and a friend of mine said to one, put your mask on. And they just laughed. And they said, we don't need to wear a mask. It's college night. We don't need to wear a mask. I mean, this is kind of where this is going, and it's...
Yeah. The higher ed, they will do the online or distance learning. I believe it was following Thanksgiving through till their semester starts in January. So they're going to do all online. I believe all of our higher ed agreed to that. Concordia, MSUM, and M-State. And
Well,
so
and again, I'm
Yeah.
not saying this is all college kids either, because
Right,
I
right.
said the age group where 77% of it is, and it goes up to the age of, and even Commissioner Mojo said even her age group, she sees a lot of
Right.
I refer to it as carelessness. I really
Right.
do.
yeah, right. It's a
But
tough-
this should speak volumes to people if they look at it.
It should, absolutely.
And
Well, it's basically Clay County ages 15 through 44 are the highest
Yep.
age groups.
yeah, well, that's about 77% of all active cases.
That's right.
Now, if there was a little bit more care and following wearing your mask and the social distancing amongst those age groups, do you think we'd see these numbers?
It'd certainly be reduced.
It'd certainly be reduced. And maybe the deaths would be reduced.
Right. And that's the hard message when there's so many people with a mindset about the masking and social distancing.
Wear your mask, people.
Yep, we agree. If you follow the public health measures until we get those vaccines, which is into the new year.
Thank you. And patience with me.
Okay, anything further?
I think that's it. Thank you.
Thank you.
Okay, well, thank you for a very informative report. That was,
Thank you.
Thank you.
really helps.
Thank you.
And I guess the message today is wear your mask.